Good morning. Today we'll be talking about sepsis. It's a very important topic, sepsis and how delays in diagnosis can be deadly. The World Sepsis Day is coming up on the 13th of September, but it's an important subject we need to talk about so people are aware of what it is and how to move and how to act quickly to prevent disaster. Thank you for coming on the program, Dr. Dosekun and Dr. Obe. It's a pleasure to have you both with us. Dr. Obe, if I can start with you as a pathologist. Sepsis is all about pathology, and I know you're a microbiologist and all about microbiology. So can you explain simply to us what sepsis is and the kinds of things that, kind of organisms and things that cause sepsis?
Right. Thank you so much, Dr. Pamela. And again, I'm happy to be here today. Right. Sepsis, by definition, is defined as life-threatening organ dysfunction that is caused by body's dysregulation to infection. What does this mean? It means that normally the body is designed to fight and curtail any external offenders like pathogens, bacterial, viruses, parasites, etc., which are the sources of infection. So the moment the body wants to start to fight them and the host immune system overreacts, now it leads to the release of inflammatory markers, or what we refer to as inflammatory mediators, that are meant to be released at a moderate quantity to be able to curtail the infection. Now, these markers are released in a very severe way, or let me say, this system goes to overdrive. And then this overdrive begins to lead to a lot of impairment in the body. And then it manifests with all of the various ways that clinicians will see sepsis manifesting, that will refer to as multi-organ damage, affecting the liver starts to misbehave, affects the kidney starts to misbehave, and all the rest. Thank you.
Wow, that's something serious. So you talked to us about pathogens, and a lot of people have heard, obviously, that when you have a serious bacterial infection, it can cause sepsis and breakdown. But most people are not aware, that other kinds of organisms, you mentioned viruses. How about things like malaria? How about things like, is it any organisms that can cause it? What really, happens, as in you describe the process of the organ breakdown. We're going to go into talk to the clinicians next. But in terms of these bugs, how do they just take over and overwhelm the body that causes this? And is it any bug that can do it?
Right. Thank you for that question. Like I said, usually the body is designed to curtail offending pathogens. And sometimes these offending pathogens can be intrinsic, meaning the organism that we have within our body. And sometimes it could be extrinsic, meaning organisms we pick in our environment, procedure, and all the rest. So when these organisms get in contact with the body, depending on the concentration or the load of the bacteria that gets into the body, and it's not necessarily bacteria. It can be bacteria, it can be viruses, it can be parasites, it can also be fungi. And the body, in a way of trying to manage them, releases too much of the markers that are meant to manage them, vis-a-vis tumor necrotic factors, interleukin-1, interleukin-2, interleukin-6, things that are meant to, release what we refer to as soldiers of the body to help to curtail this infection. So the overproduction will start to do what will become non-beneficiary to the body. So how do we get these pathogens? These pathogens For example, on our skin, we have Staphylococcus aureus, Staphylococcus epidermidis. They are meant to be protective. But again, when we have a breach in the skin, like you have a cut, the Staphylococcus aureus can get into the bloodstream. Bloodstream is not where the Staphylococcus aureus should be. If it gets to the bloodstream, then it can trigger, immune responses. For example, someone is brushing his teeth in the morning. There are organisms around the mouth, particularly Enterococcus. They can get into the bloodstream. For example, in adults, people who are into intravenous drug use, they inject themselves, they can dislodge bacteria from the skin, into the bloodstream. Although syringes are not even, sterilized, they are not clean, they could also carry bacteria that can get into the bloodstream. In neonates, that is the kind of a focus when you're cleaning them. Maybe you didn't clean the cord properly, organisms that are around, the cord area can seed into the vein, into the artery, getting into the system. They could establish infection. Some organisms are also quite common in the neonatal age brackets, which I'm sure the pediatrician will want to mention, that babies picked up, at the birth canal during the process of birth, like popular Escherichia coli, not so popular Listeria monocytogenes, Streptococcus agalactius.
So many, so many, so many, so many, and they're
So many of them
everywhere.
it really has as well.
So
Right.
thank you. If I can then swing over to you, Dr. Dosekun, since he's already started talking about pediatrics, how does, he's talked a bit about organisms and how people can get, or how the babies can get it. Can you tell us how it presents? Because people are hearing these things, they're hearing about how organs are failing and all that, and they're thinking, what? How do I know somebody has sepsis? In particular, how do I know a baby has sepsis? These babies, they don't talk, they just cry. How does a mother know? For example, a neonate and then a young child. Can you describe how sepsis presents at that age?
I think before describing it, I will also reassert what Dr. Obe said, in that sepsis is the body is at war with itself. There's a total anarchy. Now, everybody's familiar when you say you have an infection. So infections most of the time are localized. That means they are fixed in one area. Maybe you have a boil, or you have an ear infection, or some gastroenteritis, maybe some diarrhea and vomiting, or urinary tract infection. And sometimes it's not so simple. When we say you have a localized infection, it's contained. But when you have sepsis, it has become what is now meant to protect you in the body's immune system now goes on an overdrive. So there's war in the body. And instead of killing the bacteria alone, they are killing the parts of the human cells. So it's total anarchy. And the end result of this is that there will now be a problem with the function of your heart. There will be a problem with the function. So you go into shock, there's a problem with your lungs. You're not able to breathe properly, or you're breathing excessively. There will be a problem with your metabolism. That is, your blood pressure, your blood sugar may go up or it may go down. There will be a problem with your hematological system. That means your white blood cells will go up or it could go down. So there's a problem with your thermoregulation. Your temperature could be very high or your temperature will be very low. Then the most frightening thing about it is there's a problem with your clotting system. That means your blood will not clot, or your blood could clot excessively. So the body is at war, because all in our defense cells, they are protective things. They are protective enzymes, they are protective chemicals, they are protective factors. And they're all hidden within the cells of the white blood cell. But when sepsis occurs, those white blood cells go crazy. It's called activated. So they start rolling very fast looking for that nasty bug that it wants to attack. And they attack the nasty bug, but they also attack the
Body as well.
part of the human cell, the body itself. And so the blood vessels start leaking. Your capillary vessels start leaking. So you see people with sepsis, they start putting on, it looks as if they are putting on weight, they're having edema. Your platelets, those are your cells that defend when there's ever any injury. They come towards that. They start pumping excessively. So blood flow to our different organs reduce. When the organs don't have oxygen, they don't have fluids, they start dying off. So at the end of the day, you have what they call multiple organ dysfunction. And that is why when sepsis is not picked up early and it progresses, it can lead to death. And that is why sepsis can be difficult to treat, because you go into shock first, then you go into multiple organ dysfunction. So what can we do about it?
Thank you.
Babies, in children,
thank you.
In adults, in the elderly, early diagnosis.
Thank you. Thank you very much. Thank you, Dr. Dosekun. If you can just carry on, you know, it was really fascinating just before the break. If you could just carry on with your train of thought.
Yes, so like I said, sepsis is sort of like the balance between how strong that bacteria or that virus or that protozoa is and your immune system. If your immune system is down, then it's easy for a bacteria that would have normally given you a localized infection, just that area. If your immune system is down, you could transit to having sepsis, this war against your whole body. People who are prone to this are babies, because babies, they don't have a developed immune system. So babies less than 3 months, from 3 months to babies who are preterm, they can be prone to sepsis. And that is why hygiene is very important in cleaning your baby and you putting the babies on clean beddings, wearing clean clothes, and not making all visitors carry the baby, as few as possible, because they may be hammering some germs in their nose or their hands, which they would infect the baby. And instead of that baby having a localized infection, will have sepsis. Also, all pregnant women must have good personal hygiene, because if your delivery is vaginal and you're harboring dangerous bacteria, which is not dangerous to you, but to the baby, is normal to you, but to that baby, it can be problematic. So any woman who is draining fluid, you haven't yet started contractions, and you're draining fluid, you're seeing your pants are wet, you need to go to the doctor early, because it means there's a leakage in that protective bag that protects the baby inside your uterus. And then it's possible for all the normal living bacteria, because every woman down there has some degree of bacteria in them, will zip up to the baby and can lead to sepsis. And that baby can be very sick and can. Cleaning is quite important, but we must be careful what you put on your cord. We don't want any over vigorous cleaning, otherwise that can cause damage. If you have burns as a child, if you have recurrent ear infections that can be troublesome, these can be the things that can let you have sepsis instead of a localized infection. People with sickle cell anemia, their immunity sometimes is compromised, and they can be prone to having sepsis, as well as the elderly. It's now been discovered that urosepsis, and it's in the elderly, it starts off as a urinary tract infection, and in the end may lead to sepsis. So what is important about sepsis? The diagnosis. There must be the awareness, not only from the community, but within the hospitals. When they see someone with very high temperature, very low temperature, not wanting to eat, feeling, maybe as adults, they'll say, I feel so rotten, I feel so ill. The bells must go on. Is this a localized infection or is this sepsis? And we can be supported by taking a detailed history. We need to take bloods for investigation. And we must always remember, anybody where you suspect sepsis, you must do a blood culture. So when your doctor says, let's do a blood culture, don't say, oh, doctor, it's going to take a lot of money. No, because it's going to save you. They may be able to grow in a few days' time a very resistant bug. Meanwhile, you're already on a standard antibiotic regimen. So it's the microbiologist that will say, hang on, change your antibiotics. I've grown a bad bug. So all these little things we have to be aware. And it continues. And then multiple organ dysfunction, which can lead to ICU and death. Because it is not automatic that even if you go to an intensive care, you will get cured. You may just spend a lot of money and the person will die because it is irreversible. So prevention, something bad has happened, you have sepsis. Get diagnosis early, get treatment early. And the treatment in sepsis is not only high-dose antibiotics, it's also fluids. Because like I told you, the body circulation is affected. It's all gone dilated. There's no pressure in the system to drive oxygen, to drive glucose, to force to remove unnecessary things from the blood. So there's an accumulation of a lot of sepsis. Shock is all about. And if you get to the stage of sepsis where you have a problem with your blood clotting, it can be very difficult to treat.
Yes.
So prevention is better than cure. So when you see that you are feeling really rotten within you, or your child is fretting and crying, the temperature is too high or too low, the child doesn't want to feed, there's reduction in urine volume, because like I say, sepsis affects your circulation. So there will not be enough blood going to the kidneys. The kidneys will not produce enough urine. These are the subtle things. Your hands are cold. If your child is saying, I'm not feeling well, and you hold the hands and it is cold, start going to the hospital. If your child is having rigors, shaking, and chills, that's the toxins in the body being released, start going to the hospital. The child is refusing to eat, fretting, crying, start going to the hospital. And when you go to the hospital, you give a good history and say, doctor, is this a localized infection or is this sepsis? I've heard about sepsis where the body goes to war against itself. Please reaffirm to me that this is not a dangerous situation, because I don't want a complicated case. Thank you.
Thank you so much. I think that is really, really sort of puts it very simply but very succinctly, and enables a lot of people to grasp what is going on. But there's a question that came in earlier that we need to ask, and I don't know if it's for you or Dr. Obe, but the question was, how can you tell the difference between malaria, typhoid, which is what a lot of people say they have, and sepsis? And for me, can malaria cause sepsis? Can typhoid cause sepsis? Is there a difference between the two?
Let me address that question. As sepsis, it's a broad nomenclature. And there are several other entities within that concept, sepsis. Like we have said on this call, sepsis can be caused by bacteria, it can be caused by viruses, it can be caused by fungi or parasites. So when parasite cause sepsis, it is called, when virus is called sepsis, it is called viremia, meaning that the presence of the virus in the body, it's leading to, an overdrive of the immune system. When it is bacteria that is causing it, it is called bacteremia, meaning that the presence of a bacteria, which is a bug, is leading to an overdrive of the immune system. When it is fungi that is causing this, it is called fungemia. So when people use that word sepsis, It comes from the concept that we do not know the particular organism that is causing this at this point until we investigate. However, based on clinical acumen, and some other things we could see clinically, we may start to be saying, oh, this looks more like bacteria. This looks more like virus, or this looks more, a fungi. For example, if in our environment, bacteria is quite common, right? Malaria is also quite common. And when malaria leads to overdrive of the immune system, especially in individual that is immunocompromised, that is severe parasitemia, that is also sepsis. I don't know if that answers that question. And that is why appropriate diagnosis is critical to the management of sepsis.
Thank you so much. Yeah, you won't believe this. I mean, this program has been so exciting, but we only have 2 minutes left to the end of the show. So I don't know if you have any last words for us, Dr. Obe, to our listeners, for our listeners.
Well, yes, thank you for that. I think my last word would be that people should take investigation very critical in the management of sepsis. It helps a lot. And the investigation, of choice is blood culture. That's one. Two, people should also take infection prevention and control measures. Very, very critical. Because a lot of all these diseases and infection can actually be prevented. And it's actually more cost-effective to prevent them than to managing them. Simple hand hygiene, washing your hands. WHO has standard protocol for washing hands, and time we need to wash our hands. These are very critical things we could do that could reduce the volume of sepsis in our hospitals and in our environments. That'll be all from my end.
Thank you. Dr. Dosekun, any last words for our listeners?
My last words are, when your child is unwell, even up to the baby that can't even vocalize, but you can sense that the baby is unwell, please stop self-medicating. Because the baby may have an infection that is no longer a localized infection. The pharmacist will say, oh yes, you have a boil, but that boil might have become what they call cellulitis. It's gone deeper, and from there it's gone into the blood and is leading to sepsis. So they will not give you the right dose or the right type of antibiotic. So don't take chances. Now that you've all known that there is a thin line between localized infection and sepsis, and when you have sepsis, there is a fast run to severe sepsis, shock, and multiple organ dysfunction. Don't take a chance. Go to the hospital and ask the doctor, is this a localized infection or sepsis? If doctor is not sure, say, please, could you check up on the internet and convince me that this is not sepsis? I think if we're more assertive, and if doctors and nurses are more discerning in deciding whether it's sepsis or not, we will save so many lives.
A lot more lives, yes. Thank you. Thank you so much, both of you, for being on the program. It's been a true pleasure. Thank you.
Thank you for watching. Please like, share, and subscribe for new video updates.